Alright, we are wrapping up our last video on the respiratory system, talking about embryonic development, and we are going to go up through birth as well. So, I don't have a lot of slides for this one, just this one slide, but the development of the respiratory system is going to start roughly around week 4 of fetal development, embryonic development. And so starts in week 4, and then by about week 28, there are enough alveoli. The respiratory system has matured enough that if a baby is born prematurely after that point, it can usually breathe on its own. But in general, whether it's a premature birth or not, the respiratory system is not fully developed until early childhood, because the alveoli still need a lot of time to finish maturing. But between weeks 4 and 7 is when the bulk of that beginning of the respiratory structure start. So we have ectodermal tissue coming out of the head region is going to form olfactory pits, which are going to help fuse with some endodermal tissue to start forming the beginning stages of the pharynx, shown right here. And so the olfactory pits are one of a pair of structures that will end up becoming the nasal cavity. And then the lung buds are going to form at about this point in time too. And they're forming up here in this tissue area near where the pharynx is forming. So here are the lung buds starting to split off from what is going to end up being the trachea. And so we get lung buds and then bronchial buds, and we'll kind of keep growing out from there. And so the lung bud, dome-shaped structures bulging from what's called the foregut, which is this pinker tissue out here. And that's just a lot of tissue that's going to end up becoming different parts of the respiratory and digestive systems. And so we are going to eventually form the trachea, bronchi, and lungs from the endoderm tissue for the epithelial structures, and then the muscular tissue and connective tissues of those structures, as well as the visceral pleura, are going to come from this splenic mesoderm right here. And so we are going to form those lung buds and bronchial buds. We start getting that shooting off into the trachea, where that other structure becomes the esophagus, as we seal off the difference between those two tubes. And then we are going to start elongating most of those structures. So then we get some deeper bronchial buds. Now that we've got the primary and secondary ones, we're going to start getting some more tertiary-like structures start kind of branching out from there, so that we are further developing, and then you can see all of this purple tissue surrounding it is going to end up being that lung tissue. So that's where the alveoli are going to end up residing when that part of development gets there. So after week 7, 7 through about week 16, we're really just getting a lot of growth in those bronchial buds and continuing to have those branching out until we have all of the segmental bronchus deeper down here in the lung tissue. By about 8 weeks, as you can see, we're going to have our different lobes of the lungs, so right and left lobes. And then by week 16, we do have the full respiratory bronchioles are formed, giving the fetus the beginnings of all major lung structures. From week 16 to about week 24, after we've got those respiratory bronchioles formed, more development is going to involve a lot more vascularization, so bringing those blood vessels, those capillaries, into the lung tissue, and forming the alveolar ducts and the actual precursors to the alveolar sacs. Um, the cell lining, the respiratory structures are going to start to differentiate, forming the different types of alveolar cells, so type 1 and type 2. And once the type 2 cells have differentiated, they're going to start making that pulmonary surfactant. And fetal breathing movements can actually start around week 20. Fetal breathing is not the same as the breathing we do as fully formed children and adults. I'm going to come back to that in a little bit. Um, and then weeks 24 up through birth, so ideally full term, we're just going to get a lot more growth and maturation of that respiratory system. So the precursors to the alveolar sacs are forming. We're getting large amounts of the pulmonary surfactant getting produced. And that's going to kind of move in and out of the tissue during fetal breathing. Again, we're going to circle back around to fetal breathing. But really at this point, it's just getting all of those bronchioles branched off fully, make sure that they are going to carry air to all of the different subparts of the lungs where the alveoli are developing. The biggest milestone of respiratory development is going to be around week 28 when we have sufficient alveolar precursors that have matured, so that if there is a premature birth at this time, the baby can usually breathe on its own, but they will continue to develop and mature all the way through childhood. Fully functional alveoli usually aren't formed until around 8 years old. So, fetal breathing, we're not really sure why this happens entirely. We've got some theories about it, though. These can be observed starting around weeks 20 to 21, and they are going to involve muscle contractions where the fetus is going to inhale amniotic fluid and then exhale that amniotic fluid along with pulmonary surfactant and some mucus. Fetal breathing is not continuous, so it's not as regular as our breathing is. Sometimes it's going to have periods of very, very frequent movements, and sometimes it's going to have periods of absolutely no movement. And there's a lot of different factors from the person who's pregnant that can impact how often those fetal breathing movements occur. So there are certain health conditions like high blood sugar, high blood pressure, that can increase the number of breathing movements. On the flip side, low blood sugar levels and some other things like tobacco use is going to reduce fetal breathing movements. The theories are that the movements can help kind of tone the muscles in preparation for actual breathing once the fetus is born, and it might also be helping the alveoli to form and mature. But overall, they're considered to be a good thing. It's just not bad if they're not occurring super, super regularly or going through periods of time where there's nothing going on. At birth, the lungs are going to have to start breathing air for the first time, so before birth, they're still full of amniotic fluid, mucus, and the pulmonary surfactant. But as the fetus is squeezed out through the birth canal, that's going to compress the thoracic cavity, so it's going to put a lot of pressure on the thoracic cavity, which is going to cause a lot of that fluid to be expelled. So it's going to be forced out of the lungs. Any fluid that remains is very rapidly absorbed by the body quickly after birth. And the baby's first breath should happen within about 10 seconds after birth. And is not only going to be their first breath, but it's going to help inflate the lungs and actually get that air into the alveoli for the first time. But that pulmonary surfactant, again, is absolutely critical for that inflation so that we don't have the alveoli sticking together. So preterm births around 26 weeks can cause a lot of severe respiratory distress because there's not a lot of pulmonary surfactant present and these structures aren't fully developed. But we do have current medical advancements are going to allow decent survival rates for this particular scenario, but prior to 26 weeks, the pulmonary surfactant is not going to be produced in high enough quantities, and then the actual surfaces for gas exchange usually have not formed adequately, and so that is usually not going to be a good scenario. It's not going to be a good outcome, generally speaking. But the vast majority of people do make it at least close to full term, long enough for these structures to be fully developed and the baby to not have any breathing problems once it's been born. And so that is how we get from breathing amniotic fluid to breathing air, is we have to force that fluid out and absorb with a little bit that's left very, very quickly. And then without that pulmonary surfactant, we are not going to have a very easy time breathing, because we need to decrease that surface tension. And that wraps up the respiratory system, and we will continue next week talking about some other systems of the body.